All right. So you've got an infected root canal and you've decided you want that thing out of there. So why should you have the extraction done at a biological office instead of just your regular everyday dental office? Well, that depends, but I can tell you why an extraction at my office might be a little bit different than a traditional dental office. Not saying one's better than the other, but we do have methods that I think that work good in my hands. They seem to work really well for our patients, and I like the results that I get. I like the decrease in post-op pain that I've had afterwards, and I like how patients respond to the treatment. So, what do we do that might be different? Well, we remove the tooth, but before we remove the tooth, we're actually going to do a blood draw. And with that blood draw, we take a few test tubes full of blood and we spin that in a centrifuge while we're doing our other stuff. Um, and what floats to the top of the centrifuge from that blood sample is all the platelet rich fibrin called PRF, platelet rich fibrin. We're going to use that again while we're removing the tooth. It's spinning, it's doing its thing. And then the plugs at the top can be actually used and placed back in the extraction site into the socket. And it provides stem cells, it helps the immune response, it helps the hard tissue healing, it helps the soft tissue healing. And so I really like the results that we get when we're using PRF. We also will mix the PRF with bone graft material. And the type of bone graft that we use depends on the patient. I want to know what's going to work best for that patient for their ethics, their values. Some patients are more comfortable with certain sources of bone graft than others. So we've got human sources and we also have synthetic sources. So we've got multiple options where we can talk through the patient's goals and what the patient wants to achieve there. Um, Another thing that we do that might be different is we always offer IV vitamins afterwards. We do slightly different than a Myers cocktail. It's like a Myers cocktail plus because I tweak it just a little bit so that patients get a nice big dose of vitamin C that also again helps with inflammation, some B vitamins to help you just feel better afterwards, some glutathione to help process some of the medications, whether it's anesthetic, sedation meds, whatever we've used during the procedure, just to help things process that much faster, help your body do what it's supposed to do on its own. So we've talked about PRF, we've talked about bone graft, we talked about IV vitamins. Laser and ozone. We have an erbium YAG laser that we use that's really good at cleaning out sockets when we need to. And we also use ozone. I use ozone in just about every procedure in my office in one form or another. When we're talking about extractions, I'll either use it directly, apply apply the gas directly into the socket, or sometimes I'll inject it into the soft tissue around the socket. Again, we're killing bacteria with the ozone, or help stimulating the immune response in that area. And so we find that it has just a nice effect on everything. So that's how an extraction might be different at my office than another dental office.